I'm Dr. Roger McGargle. I have a Ph.D. in audiology.
My name is Dr. Katie Gamroll, and I'm an audiologist at Professional Audiology and Hearing Center. An audiologist is a healthcare professional specializing in identifying, diagnosing, treating, and monitoring disorders of the auditory and vestibular system portions of the ear. Audiologists are trained to diagnose, manage, and treat hearing or balance problems.
An audiologist studies for 4 years beyond university. We all have advanced master's or doctoral degrees.
We do study the social aspects of hearing and hearing aids, but we also study the anatomy and the physiology involved with hearing. Can appropriately evaluate and diagnose different types of hearing loss.
When we do our hearing test, we are able to diagnose the reason for your hearing loss. Hearing loss is caused by many different and various reasons. The biggest reason that we see here is it is hereditary, and unfortunately the older we get, the hearing seems to diminish over time.
For this test, we're going to determine how well your eardrum is moving. It puts a little pressure in there so it feels a little funny, but you don't have to do anything for this. I'm going to put this on your shoulder and put a little plug in your ear canal.
Our job here is to help you hear better and understand speech better. We have been in business here for 37 years down here at 4509 Leavenworth. This is our very competent and able staff. Here we have Megan and Laura and Ann, who is the office manager, has been here for 37 years. They are capable of doing minor repair and checking hearing aids when you walk in. We will give you the opportunity to try hearing aids for 60 days before you buy it. If you find it satisfactory, that would be wonderful. If you do not, we will try different hearing aids. Most other places will not try different hearing aids. If you do not want the hearing aid, we will take it back and we will charge you nothing to try it. There is no hidden fees. There is no restocking fees. I am oftentimes asked, is there a difference between an audiologist and a hearing aid dealer? Yes, the education is the big difference. We go to school for 4 additional years after our bachelor's. A hearing aid dealer takes a 6-week factory study course. At that time they learn about hearing testing, and how to close a sale. We learn about hearing as an audiologist, how it affects human beings and how it affects your relationship with those around you.
A hearing aid dealer has very little academic training. Their sole purpose is to dispense and sell hearing aids. As audiologists, we have a minimum of a clinical doctorate degree, which helps us with our background to help in all areas of hearing healthcare and not solely to sell hearing aids. We want to provide you with the best hearing healthcare possible, and if that includes hearing aids, we are able to do that competently.
If you come in here for an audiological evaluation, we will test your hearing. We will give you a full hearing test at no charge. We use, from one of the top 3 companies in the world, a very advanced digital hearing aid. This hearing aid can be programmed to your hearing loss. If you need more gain in the higher frequencies, we use our computers and we can do that. Hearing aids have changed tremendously in the last 3 to 5 years. If you suspect that you have a hearing loss, or more importantly, if those around you suspect you have a hearing loss, call us for a hearing test. The initial evaluation we do not charge for. If we find there is a problem, we will then discuss the treatment options.